Good morning. I am Dr. Sherene elhariri, one of examiner of the Royal College of Surgeons of England. We present to you today the different MRCS courses we run in vascular art. So we have three versions, A and B and C. So we show you the difference between each version. We speak today about the MRCS course, Part B, OSCE hand-on, carried on in the Cairo, in Egypt, in the Vascular Arts Center. Our course is a combination of the communication skills, physical examination, and procedure skills. We will have three versions of our course, A, B, and C. Is the important topics is fixed and some variation between each course. This is allows the student to have all varieties you can see in the exam of different colleges. For example, in the orthopedic, in each course of the three courses, we have how to examine the hip, how to examine the knee, how to examine the spine and foot drop. And in one of the courses, we have also shoulder and hand examination. In the other variation like B or C, we have how to examine the ankle. For physical clinical examination, in all the three courses, we have abdominal examination, cranial nerve examination, examine the submandibular gland, examine the peripheral vascular disease, lower limb for peripheral vascular disease, and how to use handhold Doppler. Of course, all these are fixed station in the all Royal Colleges. Also, we added in the other two versions how to examine the thyroid gland, how to examine parotid gland. We added in the cranial nerve examination how to do minimal mental status examination. In the other version, we have cerebellar examination and also examine varicose veins and arteriovenous fistula. In the procedure skill station, in all the three courses, we have a fixed how to insert a catheter, urinary catheter, male urinary catheter, how to do simple interrupted wound suture, how to do surgical knots in depth, H shape to control bleeding and hand tie, and also excision of nevus. In the version B and C, we added also how to drain an abscess and how to do file needle aspirated cytology. In the communication skills stations, we have history taking and we have many scenarios, so we change the scenario between each version. The same for history giving, which is a consent or breaking bad news or speak to the relative of the patient. And also we have different module for phone call. So in each version of our ABC courses, we have different history taking station, different history giving station, and phone call station. We put examples to comparison between the APC course. So hip is fixed in all courses. The same for catheter, male catheter insertion, wound suture in the A and B, but in C we change it to insertion of the nasogastric tube and X-ray to show air under the diaphragm in some cases of perforated peptic ulcer. Abdominal examination will be fixed in all station in the simulated patient to see the examination of different organ in the afternoon session of the first day of the course, we have knee examination fixed in the ABC courses, in the three version of the courses, cranial nerve, but in the last one we added how to do minimal mental status examination. In the third sessions, we have surgical knots, H-shaped knots to control bleeding, and also hand tie. It is also fixed in the three courses, and history taking in each versions we have different history taking, so you expose to variety of history taking or medical and surgical condition related to pre-operative post-operative evaluation of the patient. Second day of the course, we have a variation in the first orthopedic station, so it can be ankle in A and C, and also examination of shoulder and hand in the version B. The same for anesthesia related. So we have post-operative pleuritic pain, pulmonary embolism, and also in the version C, we have acute pancreatitis physiology. Phone call in each version of our course, we have different scenarios for phone call. Some to speak to the consultant, some to speak to IT IT or intensive care people to book a bed for the patient. So it's different from scenario to scenario. The last station in the morning session, second day, is neck. So you can have sometimes examination of the submandibular salivary gland. In the P, you have thyroid examination, and in version C, you have how to examine parotid gland in the neck. In the second day afternoon stations, so we have examination of the spine and the foot drop. It is in the old version. And after that, we have excision of nevus in the version A, but we have abscess drainage in version B, and fine needle aspirated cytology, FNAC, for version C. For the vascular, in the first version, we have peripheral arterial or vascular disease with use handhold Doppler. In the version B, we have varicose vein, also we use handhold Doppler. And the third version is AV fistula in patient on dialysis, and also how to use handhold Doppler. The last station in the afternoon session, second day, is how to order the operative list. So we have many operative lists to be ordered. So we ask you to arrange, so it's different from each version of the course. So at the end, in behalf of the Vascular Art Centers, we just to show you the entrance of the building. It is in the Cairo, New Cairo, Egypt, and it is in the fifth statement of it. And I hope that you happy to join our team or our course. Best wishes to all, and thank you.